Increasing food prices are being felt in shops and markets around the world. For people in the UK, this may mean eating out less often or buying economy brands. In Ethiopia, however, the impact is far more severe and could end up costing thousands of children's lives. This is one of the countries hardest hit by a combination of drought and rising food prices. Children in drought-affected areas face severe malnutrition and require immediate therapeutic care in order to survive. Indrias Getachew from UNICEF Ethiopia is in the UK this week to raise funds and awareness. I began by asking him to outline the current emergency situation.
So in terms of emergencies in Ethiopia at this time, we are responding to both a nutrition emergency as a result of drought, rising food prices, and the challenges of getting assistance to people. We also have we've been responding to floods in various parts of the country, and there are outbreaks of what's called acute watery diarrhea, and so there are various components to the emergency response. But by and large, the largest emergency that we are dealing with, the most significant one, the one which we are appealing for millions of dollars of support for, is the nutrition-related emergency situation. A child with severe malnutrition is 10 times more likely to die than a normal child. A child with severe malnutrition requires immediate treatment using therapeutic foods in order to survive. UNICEF in Ethiopia has supported the development of a new way of treating severe malnutrition using therapeutic products like plum peanut. In the past, children with severe malnutrition going into treatments faced a 30 to 50% chance of dying. Now it's less than 5%. So in other words, we know how to treat these children, and we have an excellent survival rate for children who go into treatment. The main challenge now is to ensure that we have enough resources to do that.
And how long do you expect the situation to last?
Well, we alerted the world using media starting in May, but the situation has been building up since last year, since last November. I mean, initially we had a drought in various parts of the country middle of last year, and then in Ethiopia the large rains, which last from June to September, that's where the main agricultural period takes place, and you get your harvest in October and November. Last year, in some parts you had a failure of the harvest. In other parts you had things like armyworm destroying the harvest, or floods that destroyed the harvest. This is last year. This was then compounded with second rains, the small rains as we call them, that take place in the early part of the year. They failed, so you had two back-to-back failures, and this pushed people over the edge. Then rising food prices and rising fuel costs meant that the emergency food aid, the emergency food assistance that would have come to Ethiopia was not as much as we would normally expect, and at a time when we should have been scaling up the emergency food assistance to Ethiopia. So this has had a very dramatic impact on children. Children are the first to suffer. The children are the first to fall into this state of severe malnutrition, into a state that threatens their lives. So I mean, as I said, this has all been building up. We've had a decent rainy season now, and so we're expecting the harvest to come in the next 4 weeks, in a month or so. The harvest should be coming in. Now in June, UNICEF launched an appeal for about £25 million to respond to the emergency. We've had a very generous response from our donors, and we're pleased to report that we've received approximately £20 million out of that 25 million. However, with the increased number of people that are affected, we have also had to revise our needs. And at this point, we are looking for an additional £12 million to get us through to February 2009.
What is UNICEF Ethiopia doing on the ground?
So the biggest part of UNICEF's response is with regard to the nutrition requirements of children. UNICEF is the lead humanitarian actor when it comes to nutrition. So this happens in various ways. One is the supply of these therapeutic products that are required for the treatment of severe malnutrition. The majority of it is Plumpy-Nut, which is a ready-to-use therapeutic food, and nutritional biscuits with the same nutritional components as Plumpy-Nut. This is the bulk of the supplies. We also have therapeutic milks that for those children who need institutionalized treatment, those who have clinical complications. With Plumpy-Nut and the biscuits, you are able to give these to the mothers and they can treat their children at home. So this is a major innovation for the treatment of severe malnutrition. What it means is you don't need to keep children in a clinical setting, so the risk of them catching infections is reduced. You also allow mothers or guardians to go home. They don't have to stay with their children. If a child is hospitalized or put in a clinic for the treatment of severe malnutrition, you're looking at a 3 to 4 week stay at minimum, which means these mothers are away from home, they're not taking care of their other kids, they're not engaged in any productive economic activity. So Plumpy-Nut and ready-to-use therapeutic foods are allowing the treatment at home, which is improving our response.
Are there any issues getting the therapeutic food out across the country?
Sure. The UNICEF UK has been supporting our work in Ethiopia to develop what's called the Health Extension Program and the Health Clinic Program. Now there are 30,000 health extension workers being deployed in approximately 15,000 health clinics across the country. And those that are located within these emergency areas are now receiving training on the treatment of severe malnutrition. So those health workers are learning how to identify severely malnourished children. They're going out into the communities, informing them that these services are available. Sometimes you have parents who give up and think that they can't find any support for their child and don't take them in for treatment. But the health workers are able to go into the communities, knock on people's doors literally and say, if you've got a child who's got this situation, please come to our health clinic and we'll treat them. So they are doing the social mobilization, calling the parents to come out, and then at their health clinics they've been trained to identify severe malnutrition. This is done by measuring the mid-upper arm circumference of a child. If a child under the age of 5 years has a mid-upper arm circumference of less than 11 centimeters, that means they're severely malnourished. It's a very simple test and very easy for a health worker to do. If the child does not have complications like diarrhea or other infections, then they can, based on their age, they can provide a weekly ration of Plumpy-Nut, which the mother takes home, feeds the kid. Then the mother comes back, is given an appointment to come back the next week. She receives her next week's ration. The health workers do home visits and check on the growth and the response of the child to the treatment. And this is enabling us to reach a lot more kids. At present, we're reaching less than half the children that are severely malnourished. But with this program, with the capacity to go to the village level, we are able to identify more children and provide them with Plumpy-Nut. The main challenge here is getting enough Plumpy-Nut, getting enough of these ready-to-use therapeutic foods into these villages for the health extension workers then to provide to the children. And until the larders and people's homes are full, until there's food at home, we have to continue being able to do this so that we can save children's lives.
UNICEF UK has already raised significant funds for Ethiopia through donations from our supporters. For the children of Ethiopia, the generosity of the UK public really can make the difference between life and death. This is Andy Brown reporting for UNICEF UK.